Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you're very welcome. Lots and lots of questions in. Let me go straight to a question. Hi, what would Anneliese recommend for vertigo? It seems to be caused by a sinus infection. And also, would she recommend wild yam along with a HRT patch? Okay, that's a separate question. Okay, start with the vertigo. Somebody getting vertigo that's been caused by a sinus infection, would that be common?
Yeah, I definitely would think so, Patricia, because if you think about the sinuses, they drain into the ear, and the ear passages, they all work together and they all drain into each other. Actually, a lot of times vertigo is not as a result of damage to the ear, but it's actually as a result of a viral infection that affects the canals of the inner ear, and they cause inflammation. And those canals, those little canals, are responsible for our balance. So that's why people with vertigo feel dizzy all the time and can even feel sick, like being seasick all the time. And most commonly, the drug that's prescribed is actually an anti-seasick drug, Stematol. So in terms of the natural route, it's a very difficult one. There used to be a great supplement on the market years ago, and that we used to get very good results with that when it was virally induced. So that would apply for the sinus one there. But unfortunately, it's no longer available. But basically, what was in it was a combination of natural anti-inflammatories, a bacteria called Lactobacillus salivarius, a high amount of rosemary extract. So we try and cobble it together here by using a couple of different supplements. One of them is called P4 Immune. We also recommend a probiotic with that Lactobacillus salivarius in there. And also we recommend something like Plantago or the Dr. Dealish Clare Congestion Blend, and that kind of clears up any mucus that might be in the ear that might be a kind of a leftover from an infection. So, yeah, it's a combination of those things, and you probably need to take it for 4 to 8 weeks, really, before you'll know whether it's working or not.
Okay, and then the second part of that question is the lady's obviously on HRT patches. Would you recommend wild yam while using a HRT patch?
Yes, you could try it for sure. I mean, that wild yam is kind of a natural progesterone, so a lot of people would use that as an alternative to HRT. We get great feedback on the Dr. Dealish Clare Vaginal Dryness Cream, which has wild yam in it, and that's very good for people who would experience a lot of dryness. And for some women as well, that can affect the whole kidney and urinary tract, and they become very prone to kidney infections. So wild yam could be very beneficial for all of that. And a lot of people do use natural plant-based hormones to bump up their HRT, so to speak. They don't interfere with each other and perfectly safe to take.
Okay, now Norma, your heart will go out to Norma. She had shingles about 3 weeks ago. However, since then she's been developed with post-herpetic neuralgia in her hip and back. She got lidocaine patches from the doctor, but unfortunately they caused her to feel very nauseous. Is there any natural remedy that Anneliese could recommend for her?
So I think one of the best ones really, I suppose, is the hypericum, Hypericum. It's a homeopathic remedy, and it's very good for nerve damage and nerve pain and nerve inflammation. So that would apply after surgery. It would apply actually post shingles. It can sometimes help with diabetic neuropathy as well. So it works across the board. Unfortunately, our homeopathic remedies have been disappearing off our shelves, so it might be a bit difficult to get. There is the Irish Homeopathy Company. You can call them, and you might be able to order it through them. Or I think the Hop Sack in Dublin also has a homeopathic dispensary. You might want to get in touch with them.
Hi, Anneliese. This is Kathleen in Mallow, is in her early 60s. She has what she describes as a skin tag on her eyelid. Now, she said it's very noticeable to the point that people are constantly commenting on it, like, oh, what's that in your eye kind of thing. She wears sunglasses now at this stage to try and hide it, but she wants to know, is there anything she could put on it to remove it?
I know they used to sell these kind of skin tag creams, Patricia. I never, ever saw them work. So, I don't know. I had something growing on my eye, and I used the Dr. Clare wart cream, which had thuya in it, and it did seem to help a bit. So you could try that. It's spelled Tuja. Again, it's a homeopathic remedy, and you can get it as a tablet, or you can get the Dr. Dealish Clare wart cream. But realistically, she's going to probably have to have it burned off with, frozen off. That's probably the quickest way.
And your GP can do that, can
Absolutely.
Yeah. I suppose it's just anything near the eye, you're straight away thinking, oh, what's that going to be like?
I would definitely go to the GP for that, yeah.
Okay, Kate wants to know, is it okay to take ginseng if you're on a blood pressure tablet?
Not really, no. So ginseng can help elevate the blood pressure. Now, what I would say, sometimes the benefits of taking something like ginseng can work really well. So if you need an energy boost, ginseng would commonly be used for kind of adrenal fatigue if you've been through a long period of stress. It can work very well for that, for kind of rejuvenating you and giving you a bit of your mojo back. So sometimes the benefits can outweigh the risks. So if you did really feel you need to take it, I would suggest taking it for a month, but keep an eye on your blood pressure, monitor your blood pressure. You can buy them really cheap online, and just, take it 3 times a day. And if you see it going up, stop with the ginseng straight away. But I think for short term, I know the Source of Life Gold has a bit of ginseng in there, Patricia. I think if you're taking something short term, it's fine. It's only not to be taken in the long term.
Okay. Somebody else actually is asking about taking, is it okay to take turmeric supplements if you've had your gallbladder removed? And if so, how long after surgery can you start taking turmeric?
Okay, so it's actually, turmeric would be part of a remedy for gallbladder, actually, Patricia. It has 2 jobs. One is that it's a bitter, so it stimulates bile production in the liver, and your gallbladder usually stores bile. So once you've lost your gallbladder, it's actually good to take things that stimulate bile production because you've no reservoir to hold it, so you need to kind of keep producing it. And any of the bitters will do. So turmeric is also quite bitter, and it'll work well for that. Other bitters would be things like gentian, yarrow is another great one. The Dr. Clare does a kind of a digestone blend of about 3 or 4 different kind of bitter herbs, and they'll all stimulate that bile. It also has natural anti-inflammatory effects, so you could probably start taking it straight away after surgery. The only time turmeric is not supposed to be taken is if you're on a blood thinner, because it does thin the blood.
Okay, sorry, I have so many questions coming in. I'm trying to find them all. Hi, Anneliese. I'm 57. I work in a school environment, so I work very closely with young children, and I'm inclined to pick up any bugs or flus or viruses that are doing the rounds, and sometimes I can find it hard to shake it off. What would you recommend to kind of build up before we head back into school?
So I think a couple of things, Patricia, would be really, really important. So you definitely need to be taking something like vitamin D, zinc and vitamin C, and probably selenium, because they all work really, really well together to support your first line of defence, which is your white blood cells. And then other things you could add on top of that, like mushrooms. I'm a big fan of mushrooms. The beta-glucans have a really powerful immune-stimulating effect. Another thing I'm a big fan of well is the olive leaf extract. There's benefits of that beyond immune benefits, so it works brilliantly for blood pressure, heart health, brain health. And the Comvita do a liquid one of those, which I think is absolutely superb. There's a great one we sell every year. It's called the BioNutri Elderberry Complex, and that has got all of your beta-glucans in there, your vitamin C, your zinc, etc., etc. So that will be a good one in all type of a one. And then you could take the olive leaf extract on top of that.
Okay, hi Anneliese. I am 70 years old and recently I started getting very bad pain in my neck and shoulder. Now I have had 2 sessions of physiotherapy, but the physiotherapist now is saying it's wear and tear. What would you recommend that I can do? Yeah,
so wear and tear is arthritis, Patricia, and it's very common, unfortunately, as we get older, especially in the parts of the body that would have been put under, stress and strain. So I think taking a joint support supplement at this point will certainly help. It could even, help improve your current symptoms, but it will certainly help any further arthritis. It'll slow down the development of arthritis hugely. So the 2 ones that we find very successful here in the shop are the ones we get the best feedback on. And one is by One Nutrition. It's called Joint Factors, I think. And the other one is UC2 cartilage. That's a very particular type of cartilage that comes from chicken that is really good for the cartilage in our joints. So that's a great one, especially, again, I think for autoimmune, that seems to work the best. So either of those. Collagen is very good as well. I'm a big fan of bone broth, Patricia. I always boil the bones of any meat that I get bones in. And that bone broth is full of nutrients that help support your bones and your cartilage in your joints. So if you could get that and make yourself a soup and drink that every day, you'd be as fit as fiddle.
Okay, I'm smiling at this one, but I suppose it's not too nice to the person it's happened to. Somebody said, I've literally just swallowed a fly. Is there anything I can take to pass it through my system as quickly as possible? It's obviously quite disgusted at the idea that they've swallowed a fly. How can you get it through your system fast?
Well, I mean, the only way to get anything through the system fast, Patricia, is to take a laxative. So a very high dose of magnesium. But to be honest with you, there's many cultures actually eat insects. They're a great source of protein. And your acid in your stomach is so strong that that'll shrivel up any germ that's possibly a bit.
Don't worry about it, yeah.
Don't worry about it.
Yeah, don't worry about it. And very finally, is milk thistle good for somebody who's been diagnosed with fatty liver? And also, can it be taken with other medications that are prescribed by a doctor?
Now, depends, Patricia. So anything to do with the liver, you need to be careful if you're on multiple medications, because if you improve the liver function, it actually will increase the liver's ability to detoxify pharmaceutical drugs, so your drugs may not have the required strength. So you need to do, I just would check in the health shop with your particular lot of drugs. So in terms of fatty liver happens mainly when it used to mostly be before from alcohol, but nowadays we've got so much high fructose foods in our diet, Patricia, and they're being converted to, the sugar in those converted to fat stored in the liver, and that gives you fatty liver. So milk thistle is a good start, but there was an amazing herb that we were able to recommend here in the shop up until recently, until they unfortunately took it off our shelves, and it was called berberine. It's still available overseas, and it is incredibly good for helping with fatty liver, but it also helps with insulin resistance, so it's brilliant if you're pre-diabetic, and a lot of diabetics and pre-diabetics will develop fatty liver. The alternative to that would be something like bitter melon. That's very good as well for fatty liver if you can't get your hands on the berberine. And the fourth thing I'd recommend is something called alpha-lipoic acid, which has a very protective effect of the liver. And in some health shops, they might have combo products where they'll have all of those in there.
Okay, listen, have a lovely week and we'll chat next Monday.
Thanks, Patricia.
Thanks, Anneliese. Anneliese Dressel, Health Hub Store, Times Square, Ballincollig.